So the other day, a woman walked into my office and exclaimed, "My vagina has betrayed me." It's what I call the bedroom gap. The difference in sexual expectations and capabilities of men and women in midlife. In menopause, the ovaries make estrogen less consistently and eventually stop making it altogether. Less estrogen means less collagen is made. The second effect of the loss of estrogen in the vagina is on blood vessels. When we're aroused, fluid moves from the blood vessels through the vaginal wall to make lubrication. Without blood vessels, you're not going to get wet no matter how turned on you are. I will never forget a patient said to me once, "Dr. Sophocles, when my partner and I have sex, we sing this Johnny Cash song. We sing it, I sing it, because I have to sing and laugh, or else I would cry and it would spoil the moment for him." So, while women are living in this ring of fire mercy sex world, on the other side of the mattress, things are a little different. What was first invented to firm up a floppy penis has now become a global phenomenon to optimize male sexual performance. Now, Viagra did not cause the bedroom gap, but I believe it has widened it. They are just availing themselves of what gender-biased modern medicine has on offer. So, here's the good news. Women do have options, but they just don't seem to avail themselves of them. Well, one problem may be that many doctors don't feel comfortable talking to female patients about menopause and sexual issues because they feel they were never properly trained. In fact, one study showed that 2/3 of medical training programs in the US have just one lecture on menopause, which may explain why doctors are uncomfortable and why 75% of women who go to doctors to seek care for menopausal problems come away empty-handed. Because every one of us is going to go through menopause and experience the loss of estrogen. Globally, there are 1.1 billion women right now who've reached menopause and postmenopause. I know because for 28 years, I have listened to your stories on 5 continents, and I can tell you that the bedroom gap cuts across race, ethnicity, economics, education, and geography. See, women are outliving men by 5 to 6 years, and they're spending more than 1/3 of their lives after menopause. But between the issues inherent in the bedroom gap, Viagra widening that gap, and the complexities of online dating, it's no wonder you feel your vagina has betrayed you. But it's not your vagina's fault. Sexual dogma that decrees that a woman's role in the bedroom is to please, to serve, to not impede the sexual pleasure that a man is entitled to. But I can offer you this. Since we know that deficiency of estrogen makes the vagina dry and unpleasant, then maybe one solution to closing the bedroom gap might be to replace that vaginal estrogen. We have to address this collective fear of estrogen and cancer. That fear stems from the Women's Health Initiative, the media storm that surrounded the release of that data 20 years ago. That study examined the risks of oral estrogen and cancer, among other things, not vaginal estrogen. Estrogen behaves differently depending on where and how it's used. Vaginal estrogen works genitally, locally, and has positive effects. Systemic estrogen can have positive or potentially negative effects depending on the target tissue. Vaginal estrogen has been out since 1946 and studied extensively and has never been shown to cause breast or other cancer. But we, the big we, have made vaginal and systemic estrogen falsely equivalent. And now far too many women don't use estrogen at all. Well, the thing is, we have a right to comfortable sex and a right to pleasurable sex. And so the thing is, we talked about vaginal and systemic estrogen, and there are even other medications we can use, vaginal and oral, that will help us to close our bedroom gap. So I'm talking to you millennials and Gen Zers. Well, 1, get educated, read credible sources. 2, talk about it to each other, to your clinicians, to your partners, and get specific. What hurts? What feels good? And number 3, reframe sexual and genital health as a lifelong maintenance project. And don't think that just because you can't get wet or you have wimpy orgasms that can't be fixed. We have a right to comfortable sex and a right to pleasurable sex. It is time for sex ed to progress beyond getting a condom on a banana. And it is far past time for the concept of sexual pleasure to be gender neutral. Because it's never too early to start, it's never too late to improve equal sexual pleasure for men and women. We know that staying sexually active reduces blood pressure, improves cardiovascular health, decreases stress and depression and anxiety, and is linked to longevity. And we, women, we must emancipate ourselves from the rigid roles of sex for procreation or male pleasure. My big hope is that in closing the bedroom gap, we take one small sexual step towards gender equality for all of us.